Hello, I'm Maria Williams with the Collaborative on Health and the Environment. CHE enjoys bringing you the latest environmental health science through our partnership calls and webinars, science serves, publications, and social media. I would like to welcome everyone to today's partnership webinar, which is titled Toxic Threats to Children and Teens, Preconception and Prenatal. Our moderator today is Dr. Wendy Heiger-Bernays, Research Translation Core Leader of the Boston University Superfund Research Program. We will leave time following the presentations for a brief Q&A session. You may type in questions to the Q&A feature available on the menu bar at the top of your window at any point during the presentations. After the presentations, our moderator will read out questions for our presenters to respond to. We will get to as many comments and questions as we can during the Q&A period. For those of you who called in on the phone, we have posted slides to accompany today's webinar on our website. You can download these by going to healthandenvironment.org. Please scroll to the bottom of the page and select today's webinar. On the webinar page is a link to the slides. Everyone on the webinar is muted with the exception of our moderator and our speakers. This webinar is scheduled to last for 60 minutes and is being recorded for our call and webinar archive. With that, I'll turn things over to you, Wendy.
Thank you, Maria. Welcome. This is the 17th call in a series that is co-organized and hosted by Community for Health and Environment and the Boston University Superfund Research Program. The Superfund Research Program is a multidisciplinary program with centers around the country. Each conduct and communicate research with the goal to understand and break the link between chemical exposure and disease. The centers are funded by the National Institute of Environmental Health Sciences. This research program is truly unique in that it has always emphasized solution-oriented, multidisciplinary approaches, research translation, and community engagement. CHE is a partner on the Boston University Superfund Research Program's Research Translation Core, of which I am the lead. On each call, we highlight the work being done at one or more centers across the country for CHE's membership and listeners. One of the efforts of the BU Superfund Research Program is our focus on sharing technologies, tools, and models with broad audiences. The objective of this call is to share information on preconception and prenatal chemical influences on important health outcomes, including risky behaviors, asthma, childhood leukemia, infertility, and reproductive health. The speakers on this call are Dr. Mark Miller, a pediatrician who heads up the Western States Pediatric Environmental Health Specialty Unit, and Dr. Ann Aschengrau of the BU Superfund Research Program. As Maria mentioned, we will send you a very brief evaluation survey after the call, which will help us tailor future calls to your interests. So please take the 2 to 3 minutes to respond. After my brief overview, I'll introduce each speaker, who is to speak for about 20 minutes. Their complete biographies are located on the CHE Call website if you want to know more about them. We will then engage in dialogue that will be guided by questions from you and responses by the speakers. So let's begin. Many people know that drinking alcohol during pregnancy is harmful to the fetus, and as a result, policies and behavioral recommendations have been made. When we look at rates of illness, including behavioral health and associated risk factors, we see increasingly strong linkages with our environment. The intersection of inadequate regulation of environmental stressors, coupled with our growing understanding of associated poor health outcomes in the child or in subsequent generations, raises societal challenges. More bad news about multiple environmental impacts on health need to be coupled with intervention and positive prevention strategies. So without further delay, let's hear first from Dr. Mark Miller, who I previously introduced. He's an assistant clinical professor of pediatrics and occupational and environmental medicine at the University of California, San Francisco. He's also co-director of the PESU that I mentioned and the director of the Children's Environmental Health Center at California Environmental Protection Agency, as well as co-investigator and director of the Community Outreach and Translation Core at the UC Berkeley Center for Integrative Research on Childhood Leukemia and the Environment. Dr. Miller will share some of his team's incredible work on distilling some of the knowledge linking prenatal and early life environmental causes of disease. And most importantly, he will share some strategies for prevention as well as about outreach to young people. Thank you, Mark.
Well, thank you very much. It's a pleasure to be here with you. Early life exposures can result in programming of physiologic systems that can be lifelong. But an easy way to visualize it, at least for me, is actual changes that are physical in nature. This figure illustrates the impact of exposure to ozone and house dust mites during the first 6 months of life in primates. If you look at the second diagram on the left, which is a monkey that's been raised on clean air, and the one on the far right, one that's been raised to 6 months of age with house dust mite, antigen, and ozone exposure, you can see that the bronchi and bronchioles that are exposed grow longer, they're narrower, they have fewer branches, and you can't see it on this, but the muscles that surround the tubes are oriented in a way that they more effectively squeeze them. These are all things that predispose to asthma and are permanent changes. Now, if you tie that to this figure, which is in humans, and it looks at lung function at 2 months of age and following these babies all the way up to 22 years of age, you can see that if you're in the bottom or top quartiles, so you have the best function or the worst function, that tracks all along, so that your lung function as a 2-month-old predicts your lung function as a 22-year-old. So that early life exposures actually result in significant lifelong effects. We realized at Circle that physicians may not be thinking about environmental exposures impacting lifelong health, or aware that significant health impacts of these exposures. So we conducted a survey of pediatric oncology providers, 89% of whom say they regularly get questions about environmental exposures from families. Over half of them said they were uncomfortable discussing these exposures when people brought up questions. Fortunately, 92% said they would find it very helpful to have more information and better understanding about environment and health. As a result, we developed the Story of Health, which is a multimedia ebook that follows various members of this family that are centered around a family reunion. It takes an ecological approach to considering health, so that it integrates influences that range from the molecular level to the individual, their families and close relations, to the community, society, and ecosystem, and include influences from preconception and throughout life. This is a page from Brett's story, a story about a child with asthma. In the center of the page is a link, which looks like a television set, to a short story by Roz Wright, who's a prominent researcher in this area from Mount Sinai in New York. And she's discussing the impact of stress combined with environmental chemical exposures for the risk of development asthma. So the story format is full of engaging graphics, and if you look at the picture on the center bottom, there's a ripped picture, and this represents divorce. So that's just an example of how engaging these things are. Throughout the Story of Health, there are various links that you can click on and pop up, such as these videos, and also links to various resources, including materials from many of the children's environmental health research centers. This is a page from our most recent story on infertility, Rieko and Toshio's story. You can see that it includes in the center links to information about bisphenol A and how it can mimic it, estrogens, DES, and parabens, just as examples, and how these impact reproductive health. This page is talking about air pollutants. The center pop-up on air pollution and fertility describes a study in New Jersey where families with traffic-related air pollution from a neighborhood that was next to a highway toll booth experienced a reduction in preterm birth when an easy pass electronic toll system was installed, reducing the amount of air pollution in their neighborhood. Similarly, we discuss issues about male reproductive health. This example, DBCP, which was a soil fumigant that was used in the United States and is toxic to sperm and testes and caused male infertility in workers. 30 years after the discontinuation of production near a California plant, there's still a need for some wells to have special filtration systems to take this out of the water. And then we discussed some background material for women who are, born with, as opposed to men who continue to make sperm. Women have a finite number of oocytes in their primordial follicles. When they're born, you don't continue to make new ones. At menopause, the number of follicles rapidly declines, but some chemicals can decrease the follicular pool earlier, as you can see in the earlier lines that are shown that for examples like PAHs, 2-bromopropane, ionizing radiation, and chemotherapeutic agents, which can cause early menopause or decrease in the ovarian reserve, the number of follicles that are available for pregnancy. In this story, which is Stephen's story, we follow a 3-year-old boy through diagnosis and treatment for acute lymphocytic leukemia. As an example, the bottom right picture shows the family at work at their nursery, and by including that in the story, then we have an opportunity to discuss pesticide exposure and as it is associated with risk for childhood leukemia development. The father smoked prior to pregnancy in this story, but quit when the mother found out that she was pregnant. Paternal smoking preconceptionally is associated with increased risk, as is shown in this meta-analysis of studies looking at paternal smoking around the time of conception and risk for childhood leukemia, which is increased in this study about 45%. In the California study that I'm part of through the CIRCLE program, the risk was primarily seen when there was both preconception paternal smoking and the child was subsequently exposed to secondhand smoke after birth. These are some examples of how preconception or very early prenatal exposure result in an increased risk of childhood leukemia. So painting your house before 3 months of age, before 3 months prior to conception was associated with about a 50% increase in risk. So this is assumed to be related to solvents, which we'll be hearing more about later today. As I mentioned, fathers' preconception smoking has been associated both with acute myelogenous leukemia and acute lymphatic leukemia. Folate supplementation of the mother is associated with a reduced risk, as much as 50% reduction in risk in some cases. So these are just examples that from the work that we've been doing that indicate that preconception or very early prenatal exposure is important, and you need to keep in mind that most women do not come in either for preconception counseling or are usually not seen until perhaps around 2 months or later in their pregnancy by care providers. In California, we looked at risk for childhood leukemia by ethnicity. The bottom blue line is the increasing risk over the last 25 years or so in California for white children. The top line is Latino children, and you can see that not only have they always been noted to have a higher risk, but that their risk has been growing at a rate that outstrips the white children over a period of 25 years. So it's not purely a genetic risk, although certainly genes play a role in what we've always known as far as increased risk in Latinos, but the relative risk related to white children is not genetic, and this rate of increase and indicates that there's some environmental exposures that are important. So putting these various things together, the Circle program and our PACU decided to begin this program called Improving Environmental Health Literacy of Young Adults. It notes that the high and increasing rate of childhood leukemia in Latino children, that preconception exposures are important, and that influences to try to educate and change behaviors preconceptionally are missing at this point, and that these exposures are related to other outcomes. For example, tobacco smoke, we know, is related to many a variety of other outcomes besides childhood leukemia, and that's true for all these. And folate is protective for neural tube defects and possibly for autism. So one of our products that we've developed is a 10-minute video called Love in the Time of Toxicants. And the idea is to outreach to community health workers so that they can work with adolescents and young adults and get this message across premaritally that care for pesticide exposures, tobacco cessation, and folate supplementation. These are all things that should be taught and considered. And we're working particularly with groups Promotoras de Salud in California and Arizona. This similar story, Rosa and Carlos Get Married, is a comic book that we've developed using messaging that was already developed from the story of health, but in a much simpler format. And you can see there's discussion here. Rosa's mother is a nurse, and she's recently been at a training to learn about environmental exposures, and she's talking about folate and cleaning products, and it's fun and people love it, and they've gotten a lot of feedback that this is something that's really relatable to and engaging. Similarly, we've worked to develop infographics. This is one example. Everyone knows that mom smoking during pregnancy is bad for baby, but did you know that fathers smoking, also including before conception, is an issue. So mothers smoking, actually, the information is not as strong as preconception paternal smoking for childhood leukemia. But the bottom line is at the bottom of this: future parents, start protecting your children's health before they are conceived. This is a thank you note from one of the Promotora de Salud trainings that we've done there. Vicky Leonard from our group and Jose Camacho have been doing these, and it's very rewarding. People are very interested, and it's just a wonderful group to work with. I'll conclude with this slide from our newest Story of Health chapter on infertility and reproductive health, just to show you that it deals with all kinds of environmental factors that can influence and interact to influence reproductive health, including radiation, stress, nutrition, etc. You can see the top middle has reproductive effects of solvents. And with that, I'll conclude my portion, and we can move into further information about solvents.
Thank you, Mark. Let's hear now from Dr. Ann Aschengrau, Professor of Epidemiology at the Boston University School of Public Health. She will discuss her study on the linkages between prenatal and childhood exposure to tetrachloroethylene or PCE contaminated drinking water and increased occurrence of risk-taking behaviors as a teenager, including illicit drug use. Given the drug abuse crisis currently taking place in the US, this study has important real-time potential policy implications. Dr. Aschengrau leads the BU SRP project, Impact of Early Life Exposure to Environmental and Social Stressors on Substance Use. So thank you, Anne.
Thank you. So today I'm going to be speaking about my research on the long-term effect of early life exposure to tetrachloroethylene contaminated drinking water. This research was conducted as part of our Superfund Research Program at Boston University, which was funded by the National Institute of Environmental Health Sciences. Just a little overview of my presentation. I'll be telling you a little bit about the setting of my research on Cape Cod, Massachusetts, how tetrachloroethylene contaminated Cape Cod's drinking water, and I'll be using the acronym PCE to stand for tetrachloroethylene. It's one of its chemical names. I'll be speaking about the methods and results of my birth cohort study, as well as the context of my findings and some conclusions. So as many of you know, Cape Cod is the hook-shaped peninsula in the southeast portion of Massachusetts, and its long coastline makes it a very popular tourist destination. There are 15 distinct towns on the Cape that have about 200,000 permanent residents. It's a mainly white, non-Hispanic population. There is a small Native American population. They're the Wampanoag Indians. And this area has undergone tremendous population growth since the 1970s. It's a popular retirement area, and so the growth has been skewed towards the older ages. Now, the main source of drinking water on Cape Cod is a large groundwater aquifer, which is tapped using shallow wells. The local water companies are responsible for pumping and delivering the water to the consumer through an extensive pipe network. Most of the people receive their drinking water from one of these companies, but some people have private wells. This particular diagram shows the distribution network of 4 different water companies that serve the Cape Cod town of Barnstable. Now, what exactly is tetrachloroethylene and how does it typically contaminate drinking water? Well, it's a very important solvent that's used in dry cleaning and metal degreasing. We estimate that there are about 650,000 people in the United States that are exposed through their work. And because it's typically used in small, geographically dispersed and poorly controlled facilities like dry cleaners and garages, it turns out that PCE is a very common drinking water contaminant in the US. Various surveys have been done where an estimate of 11% of wells and 38% of surface water supplies show some evidence of contamination. Now, while improper industrial disposal is the typical manner in which PCE contaminates drinking water, an unusual source of contamination occurred on Cape Cod. The source was a vinyl liner that was applied to the inside of the water pipes in response to complaints about the taste of the water. The liner was applied in a slurry of vinyl resin dissolved in PCE, which, because of its volatility, was assumed to disappear during the curing process. However, because of inadequate drying time, substantial quantities of PCE remained in the liner and slowly leached into the drinking water supplies. The contamination was discovered by accident in 1980 when the water was tested for other compounds. A survey was done, and about 660 miles of vinyl lined pipe was determined to have been installed across Massachusetts in 91 communities. About a quarter of the pipes were installed on Cape Cod because the area was undergoing substantial residential development during this period. When water tests were done, they revealed PCE levels in the affected pipes on Cape Cod ranging from 1.5 to 7,750 parts per billion, a very wide range depending on the rate of flow of the water. Now, our team has used this quote unquote natural experiment to learn about the health effects of PCE in drinking water among individuals exposed during adulthood and in early life. And today I'm going to tell you about our birth cohort study of neurotoxic effects stemming from early life exposure. Now, PCE is actually a well-recognized animal and human neurotoxin. However, most of the human research that has been conducted has been done among occupationally exposed adults. There you see, as a result of acute exposure, symptoms ranging from headaches, dizziness, unconsciousness, even death from respiratory depression at very high exposure levels. Chronic exposure among adults exposed have resulted in impairments in memory, attention, and vision problems. However, there's very little information available on the impact of early life exposure, especially in community settings. Only a few studies have been done. They've been quite small, and they've only examined short-term outcomes. So a number of years ago, we launched what's known as the Cape Cod Health Study. It's a retrospective cohort study, and it was specifically designed to examine long-term neurotoxic effects of early life exposure to PCE in an environmental setting. And we took a very broad view of neurotoxicity. We looked at diminished performance on neuropsychological tests, vision problems present on examination, structural brain changes, looking at MRIs, as well as questionnaire data on outcomes such as mental illness and risk-taking behaviors. Our source population were children born between 1969 and 1983. This is the exposure period. To women who lived in one of the Cape Cod towns that had some vinyl lined pipes. And basically we were comparing two groups of individuals, children who had early life exposure and children who were unexposed. The subjects were initially identified by cross-matching the maternal address from birth certificates with water company records on the location and installation year of the vinyl lined pipes. We had to review about 14,000 birth records, I might add by hand, to identify the 1,910 exposed children, as well as 1,928 unexposed children. And the birth certificates that we viewed looked a lot like this one, which belongs to Barack Obama. The children and the mothers were traced and invited to participate. And the traced mothers and their kids returned self-administered questionnaires. There was about a 70% response rate from the moms and about a 40% response rate from the children. And the questionnaires asked about demographic characteristics, occupational and non-occupational sources of solvent exposure, as well as other confounding variables. We also got information on variables that are relevant to drinking water exposure, so bathing habits, tap and bottled water consumption, and what their drinking water source was. Were they on a public supply or did they have a private well? The children also provided information on their risk-taking behaviors during their teen and adult years. And the risk-taking behaviors were defined as cigarette smoking, alcoholic beverage consumption, and illicit drug use. And we obtained information on specific drugs ranging from marijuana all the way to heroin. Now, alongside the questionnaire data collection, we had to figure out the children's exposure to PCE. And this was done based on a leaching and transport model that estimated the relative mass of PCE that was delivered to each residence from the prenatal period through the child's 5th birthday. There were changes to the water systems that didn't allow a longer exposure assessment period. And this was a rather complicated process, and I'm just going to give you the barest of details about it. But basically, 3 pieces of information were needed for determining the PCE exposure. 1 was the vinyl line pipe locations. 2 was the subject's residential locations. 3 was the leaching and transport algorithm. And so here is a picture, an original map of the water pipes that we got from one of the water companies. And you can see it's quite old. And the map is designated the vinyl line pipes with a yellow magic marker. And there are actually handwritten notes on the map indicating the year that the pipe was installed, as well as its diameter. And these characteristics were essential for us to determine someone's exposure. We actually turned all of the information that we got from the water companies into our geographic information system, and we ended up with these GIS maps of the water pipes. And you can see that the vinyl line pipes are red, and the other pipes, the unlined pipes, are in blue. And the other thing that you should notice about this map is that the pattern of contamination was very irregular. Now, we used the leaching and transport algorithm to ultimately estimate the annual mass of PCE that entered the residence. And this process involved utilizing modeling software called EPANet that was developed by the US EPA. And what we ended up with is something that looks like this, the pipe distribution network with exposure levels. The dots on the map are called nodes, which are points of consumption along the distribution system. Each subject residence was assigned to a node. And here, the blue dots represent low PCE exposure. The green, aqua, and yellow dots represent medium PCE exposure, and the red dots represent high exposure levels. Now let's turn back to the cohort study population. Here we have 2 columns, the subjects with prenatal and early childhood exposure, and then the unexposed subjects. And as you can see, the characteristics of the exposed and unexposed subjects were quite similar. And this is actually the result of the irregular pattern of contamination. The study participants were predominantly female, white, and college educated. Their average age was 29 when they completed the questionnaires. A small portion had jobs that involved solvent exposure. Nearly a quarter reported a history of mental illness, which was mainly depression. Nearly all of the subjects' mothers received prenatal care while they were pregnant with the study subject, and a fair proportion of the mothers smoked cigarettes and consumed alcoholic beverages during the pregnancy. Now for some results. So this table shows you the frequency of risk-taking behaviors as a teen. And again, this was self-reported from the children. And the teen age years was defined as 13 to 18 years. And these frequencies are in our study population are actually generally higher than national estimates. So let's just go over some of them. So ever being a binge drinker, so that's 4 drinks at a time for boys or men and 5 drinks at a time for girls. So 35% of the population reported that. Having a first drink less than or equal to 13 years of age, 19%. And this wasn't just like a sip that was taken from a drink, someone else's drink. This was defined as an actual drink with quantities involved. Ever using any illicit drugs, 55%. Ever using 2 or more major drugs. A major drug was defined as all of the drugs that we asked about except for marijuana, 13%. And then just here's some data on specific drugs. Ever used crack cocaine, 9%. Ever used hallucinogens, 18%. And again, these are behaviors during the teenage years. And here are our findings, so our epidemiologic findings regarding the association between PCE exposure and these risk-taking behaviors. We saw that highly exposed individuals experience 30 to 40% increases in the risk of using major illicit drugs. So the risk ratio for teen use was 1.4, the risk ratio for adult use was 1.3, and of course there's a lot of overlap between the teens and the adults. About 75% of the teen users went on to continue use as an adult. The risk ratios were even higher for the use of 2 or more major drugs. It was 1.6 for teen use, corresponding to a 60% increase, and 1.5 for adult use, corresponding to a 50% increase. And we looked at the specific drugs that these individuals reported, and we found increases in risk for crack cocaine, psychedelics, hallucinogens, club and designer drugs, Ritalin without a prescription, and even heroin. And the risk ratios for specific drugs ranged from 1.4 to 2.1. We also saw 30 to 60% increases in the risk of certain smoking and drinking behaviors among the most highly exposed subjects. And I should say the definition of high exposure were people that were in the upper tertile of the exposure distribution, so the upper third of the distribution. And I want to emphasize that there was no increase in risk among individuals with low or moderate levels of exposure. Only increases were seen with high exposure. And I should mention that there was no increased risk with marijuana use. Now, these findings are very provocative, and we really need to put them into context. And one of the ways we put them into context is to look for biologic plausibility. And so there, PCE is a recognized neurotoxin. It's a small molecule, it's fat soluble, it can cross the placenta, and it can cross the blood-brain barrier. It also has a high affinity for the lipophilic tissues of the central nervous system. Now, its mode of action for neurotoxic effects is unknown. Possible mechanisms include changes in the fatty acid profile of the brain, loss of myelin, and apoptotic neurodegeneration. We also need to put the context of our provocative results in the rest of the epidemiologic literature. And well, this is really the extent of the literature before we came along and did our cohort study. The literature is very, very sparse. You can see there are basically 4 different studies that are listed. They were done quite a long time ago. 3 of the 4 were looking at the offspring of mothers who were exposed occupationally to solvents during pregnancy. 1 conducted in New York by Spector looked at environmental exposure coming from a nearby dry cleaning facility. They're all small studies. You have the numbers of subjects given, and the studies are really all among young children. The outcomes that were examined were cognition and behavior, and you see among the results, the 2 top studies, the ones listed on the top, show that there were some effects: lower language scores, more behavioral problems such as inattention and hyperactivity, while the 2 studies listed at the bottom didn't find any impairments. So the prior literature is actually very small, and the findings are also mixed. So there's really, I think, a lot that we need to do to further investigate this topic. Our particular study demonstrates how scientists can take advantage of what's a unique natural experiment to learn about the health effects of an environmental pollutant. And we had many fortuitous circumstances that enabled us to actually conduct this investigation. First and foremost was the availability of the historical data, as well as the cooperation of the water companies. If they hadn't kept those old maps, and if they hadn't been willing to share them with us, we would never have been able to conduct our research. We were also fortunate from an epidemiological perspective to have a high prevalence and a wide range of PCE exposure levels. So that enabled us to look at low, medium, and high exposure levels. And we also had little confounding, and this was primarily due to the irregular pattern of contamination. Virtually next door neighbors could have different exposure levels. One could be exposed, the other one could be unexposed, and it all really depended on the direction of the water flow through the pipes.
And can you wrap this up in the next?
Okay. There were also many challenges. The biggest one was misclassification, and we had little information on the social environment. And just giving you some references that you might want to get, and also thank my collaborators, without whom I would not have been able to conduct the research. Thanks.
Thank you, Anne, and I'm sorry to have hurried you. I do want to point out that the story or the piece that Anne is presenting us with is actually included in the unintended consequences in the pipe replacement in the story of health that Mark referred to. So I would like to open it up now to questions. If anybody in the anybody who's listening would like to ask questions to either Mark or Anne, that would be great. In the interim, I'll ask a question or two. So we'll start with Mark. I wonder if you can discuss how effective the stories of health are in the targeted populations and how this kind of effort can be leveraged by others.
Thank you for that question. Well, so who is the targeted audience? We in making it, had to make some decisions about that so that it was appropriately at appropriate level of knowledge for that. And we targeted clinical people, nurses, doctors, health educators. And then we also said, well, we want it to be available to people that were interested in getting into or possibly into children's environmental health from an NGO perspective, or within public health schools, et cetera. This product, the Story of Health, is a collaboration between Agency for Toxic Substances Disease Registry, the California EPA OEHA, Collaborative for Health and the Environment, Science Environmental Health Network, and MyPaySu, and also the Circle Research, Children's Environmental Health Research Program. So it was a lot of different members. We only really have good information about those who've taken it for continuing education credits, which they get from the CDC. We've had over 8,000 individual chapters signed up for credit, and given out something like 14,000 hours of continuing education credit. And what we see from an evaluation that they have to do in order to get those credits, after they've taken the course, is all the things that we would like them to say, like, this will be helpful and I can use this in the work that I do and I plan to, and don't see any major obstacles. 90% or greater that took it, answer in that kind of a way. So we've gotten very positive feedback on it.
Great. I have a couple of questions from the audience. I'll start with, we'll switch over to Anne now and then go back to Mark. So for Anne, can you comment on what else might have leached from the vinyl-lined pipes and how you were certain that PCE was the chemical, it says, that caused health problems?
Well, there are other contaminants on Cape Cod, like trihalomethanes. There were other instances of contamination from like leaching landfills. And in order for those chemicals to confound the results of our study, they have to co-occur with PCE. And they did not co-occur with PCE. So the areas where, say, the PCE levels were the highest were not the areas where these other contaminants were present. And so we feel really confident that the results are not due to confounding, due to either the participant characteristics or other contaminants.
And there's another question related to that. Were the vinyl pipes removed on Cape Cod and other places, or are they still there?
Well, they're still there, but it was too expensive to dig up the pipes and replace them. 660 miles of these pipes were installed just in Massachusetts. And so the Massachusetts Department of Environmental Protection began a program of flushing and bleeding, where they flushed a lot of water through the pipes and then let it bleed out onto the streets. And so it was sort of like a rinsing process. And they monitored the success of the flushing and bleeding and ensured that the levels were reduced. Now, the thing about that was that at the time, the target for reduction was to be below 40 parts per billion, which is 8 times the current MCL. So even though they did the flushing and bleeding, their target was what we would consider today relatively high. They've continued to monitor the PCE levels over time, and they have definitely gone down, and they are pretty much all below the MCL today.
Thank you, Anne. For Mark, which is the level of awareness among general pediatricians and gynecologists about environmental exposure and risks?
Well, they're not where I would like them to be. We've been working on this for a long time, particularly in the pediatric community. And the last several years, the OBGYN community has really stepped up to try to increase environmental health literacy among their community. So I'm not sure how to answer that other than that it's increasing. You know, the Academy of Pediatrics has long had a committee on environmental health, and that's active. They publish the Green Book, the Handbook on Pediatric Environmental Health, which is in its 3rd edition or the 4th edition coming out. Recently, it was translated into Mandarin, is getting distributed in China.
Wow.
Yeah.
I'm going to jump back to Anne. Might you share your next steps as you further investigate linkages between PCE exposures and risky behaviors? I'm going to combine that with another question, which is, did you get other information about the health of the children exposed? For example, obesity or infertility rates?
Yes, we did get a lot of other information from the health of the children. Really well, they're young, right? So there were only 29 when they filled out the questionnaire. There was a little bit more cancer occurrence in the offspring, but I wouldn't say very much about it because the numbers were small. There was an increased risk of post-traumatic stress disorder and bipolar disorder in the children. But other things like hypertension, obesity, those were not increased. And so we're actually going back. We've received additional funding through our BU Superfund Center to send the children who responded to the previous survey, to send them another questionnaire. And so we're going to update all of our information on their health, including their risky behaviors. And, but now we realize one of the main flaws of the prior study is that we didn't get much information on the social environment. And that is of such great importance that it needs to be addressed in the new study. So we'll look at social stressors like childhood abuse and neglect, household dysfunction, negative peer relationships. All of these things could bear upon their decision to use drugs and consume alcohol.
Okay, I think we have time for a few more if there are others out there. I want to go back to Mark. You present a number of great examples of environmental factors and preconception health. Are there ones that resonate particularly well with young people and others with clinicians? Are they the same or different, sort of different for different people?
Well, I think for clinicians, what tends to resonate, I think, are examples in their area. You know, so if you're a pulmonologist, you're interested in pulmonary things. If you're a pediatric oncologist, you're interested in cancer. And so, you know, I think we try to use stories, which is the long-standing way we learn in the medical world, which is cases, but those are basically stories. And so I think that's a key to it resonating is, you know, here's how it actually played out in real life. You know, there's a difficulty in reaching the clinicians in that we're talking usually about population health and, you know, as far as these environmental exposures, and clinicians are used to thinking about the child or the person who's in front of them, and it doesn't translate one-to-one. You know, that you were in increased risk doesn't mean that even though you For example, pesticide exposure may be related to increased risk of childhood leukemia. It doesn't say that the child that's in front of you had pesticide exposure. That was in fact the cause. So that's a bit of a complication, and I think we need to do a better job of training our clinicians in general public health.
I think we see that with our students as well. And I don't see any other questions. I think our time is just about up. If anybody has a last minute one, that would be great.
I have a comment.
That's fantastic.
Yeah, I just on Anne's work, which is so tremendous. There's so little really about you know, the realm of psychiatric behavioral issues. You know, there's some as far as attention deficit and autism work, but all this other spectrum of stuff, which we have huge reason to expect that these chemicals affect, you know, there's so little information. So it's really exciting to me. Thank you, Anne.
I agree. I want to thank both of our speakers and Che for partnering. And I'll turn it over to Maria.
Okay, thank you so much, Wendy. We are approaching the end of today's webinar. A video recording of this webinar will be available on the Che website soon. Tomorrow, you will receive an email containing a link to the recording, as well as to the survey mentioned by Wendy. Che's next webinar will take place this Wednesday, December 6th, and is titled, The Future of Environmental Health, Engage Communities and Strengthen Partnerships. This is the fourth webinar in our new series, 20 Pioneers Under 40 in Environmental Public Health. You can RSVP through Che's website, healthandenvironment.org. If you are new to Che and would like to stay updated about upcoming events and more, please sign up to receive our newsletter by selecting the Join Us tab at the top of any page on our website. Additionally, if you appreciate these Che Partnership webinars, bringing you the latest environmental health research for free, we encourage you to support Che's ongoing work by making a tax-deductible donation via our secure website. Again, our website is healthandenvironment.org. With that, I would like to thank our speakers for taking the time to present today, and Wendy for her excellent moderation. Thank you so much for joining us, and have a great day.